Hello, my name is Abdurrahman, and I'll be giving this lecture on manual muscle testing. So, what is manual muscle testing? Manual muscle testing is basically the procedure to evaluate the function and strength of individual muscles or a muscle group based on effective performance. The movement is related to the gravity, so it's either gravity assisted or gravity resisted, and manual resistance, which is applied by the physical therapist. It is an objective measure which is documented in the chart notes under SOAP. It's used in evaluation to identify the weakness or pathology used in treatments to document either progress or the lack of progress. So, manual muscle testing requires some skills to be able to perform it. One of those skills is having the knowledge of anatomy. And by having the knowledge of anatomy, you'd be able to palpate the different structures in the body, and be able to also observe for any contraction or twitches while doing the palpation. Um, we have to have also proper assessment so that we would know what grade should a muscle be when it performs a specific action, as in resistive to gravity, and also at the same time a manual resistance is applied. That would give it a grade of 5/5. So we also have to emphasize if we want to test a group of muscles or an individual muscle. So that basically it goes back to the knowledge in kinesiology, of what muscle contracts or is mostly active in a particular range of motion. So some factors are actually they differ from person to person, and they sometimes would affect the assessment. You never know. It's really it depends on perspective of the person that you are actually testing. So one of the factors is actually the age. The extremes of ages could actually cause a person to overly guard an injury and so on, or be less tolerable for pain, and be more fatigued. If you do multiple trials one after the other, that would actually cause fatigue, and then you might give a grade that is less than the actual grade of the muscle, or you could give actually a grade higher than what the muscle strength is, because due to the perspective of the patient, if he wants to push themselves more, that would cause them to do a Valsalva maneuver, which would actually increase their strength momentarily, and that would give you a wrong diagnosis. So you have to look for any compensatory movements also, and keep in mind their gender, also how big is their the muscle size, and if if they're afraid of doing the movement due to the pain and so on. You need to also communicate with them to make sure that they're able to do the procedure correctly without any compensatory movements and so on. So some of the precautions while doing manual muscle testing is you have to be careful with people that have increased sensitivity to pain, or if there is a risk of excessive fatigue, especially in multiple sclerosis. And also some patients are more or less tolerable to pain. If they might actually not give out the actual muscle strength while they're doing the movement due to the pain that they're feeling. And we have to really be careful also with pregnancy, if it's present in female patients, especially in positioning. We cannot position them in prone, for example. You have to be either short sitting or long sitting or supine. whichever is comfortable and according to the procedure for testing a specific muscle. So for contraindications, there's a lot of contraindications, but some of them are doing manual muscle testing after surgery, especially after tendon repairs and so on. That's a no. Abdominal surgery, if there is also a hernia, that's a no. Acute care settings, so if a patient is lying in bed and they have tubes installed and so on, you cannot test the abdominals or the back extensors while they're lying on bed, so you cannot really change the position. And also patients with cardiovascular diseases, and if they have DVT, like if you palpate it and you feel that they might have DVT, you should not perform MMT because that could dislodge the DVT and it would actually cause even more complications. If they also have a pacemaker, MMT could raise the blood pressure and could actually affect the pacemaker, and that's a no. Also, acute fractures or acute ligament tears, we should not do MMT on patients unless it's after a subacute or chronic situation already with the patient, especially after surgery, after repairing the fracture with arthrodesis or a ligament repair and so on. That's when we would be able to perform MMT. So there are different methods for actually employing the manual muscle testing. We usually use a dynamometer, particularly for grip strength, and there are some other devices like Biodex or so on that actually checks the muscle strength or the force applied from a muscle output, basically. Or we could use the manual resistance, which is really inexpensive and it just requires the physical therapist and a proper positioning of the patient. There is actually multiple methods for this. Like for example, the patient basically pushes against the resistance of the physical therapist, and it's either with gravity or against gravity and so on. But you could actually have the changing the range of the motion of the particular limb, which would cause it to test either multiple muscles or isolate a specific muscle and test that particular muscle, which comes down also to your knowledge in kinesiology and so on. So the general procedures for MMT, there are some procedures that we should keep in mind while we're performing the MMT on patients. Like for example, we have to position the patient correctly and having them able to support their body and being comfortable so that they could actually concentrate on that particular limb or part or muscle that they would be putting all the effort into. They also need to know the verbal cue, which is the hold at available pain-free range of motion, and not to move from the resistance that is applied by the physical therapist. We have to also note if the motion is anti-gravity or not, because if a patient is not able to perform the motion against gravity, we could actually make it gravity eliminated, which is horizontally, or we could do it gravity assisted, which is downwards. So it's basically either upwards against gravity, horizontal, which is eliminated gravity, or it would be downwards, which is assisted with gravity. But if it's assisted with gravity, it could actually, it's just a grade of zero at this point, because the patient doesn't do any effort at all to move the muscle, and it's a different muscle. So basically, we have to also keep in mind in stabilizing the proximal limb, and watch out for any compensatory movements such as shoulder flexion. For example, there is a compensatory movement where the shoulder actually protrudes upwards or rotates upwards, which causes an increase in range of motion of the shoulder in shoulder abduction or shoulder flexion. So we have to observe that attentively and be careful of it. We also need to note that the resistance should be applied perpendicular to the limb, so that it wouldn't be so that the patient could be tested, and a resistance should be applied in the right direction and with a gradual force. So it's not sudden, it shouldn't be sudden. If you do it suddenly, you could cause like a tear and more complications instead of actually just testing the muscle. So we should be careful with that. And both sides should actually be assessed, because if we do not check the other side, we cannot really compare the strength of the patient for their left and right. For example, if their right is the one that has the pathology or the problem, we should test the left to compare the both of them, just to see what is the scale that we're working on. If the left one is all right and they're able to use it, then the right one should be, if the left one is 5/5 and then the right one is 3/5, we would be able to scale it based on the person's the person's capabilities, basically. We should also provide clear verbal cueing and explanation while performing the MMT. For example, proper positioning, and why do we position the patient that way, and why does he need to hold against the resistance, and so on, in a particular range of motion, because they wouldn't know why we require them to actually be in that position, and so on. So one of the important procedures to keep in mind while doing the MMT is to palpate the muscle and observe the patient while he's doing the active range of motion against gravity, just so that we would eliminate the possibility that the patient would not be able to do it against gravity, and they would have to do it gravity assistive or gravity eliminated. We should also keep in mind that we have to look for the comfortable parts in the limb while applying the force. So we shouldn't use bony parts from our hands, like for example the ulnar part of the forearm. That would actually hurt the patient. We should use our palms or the lumbricals just to hover over the limb and apply the force. So this is the grading system for manual muscle testing. Some of the grading systems actually changes depending on the limb that is being tested, like the cervicals and the lower extremities. It could actually change, but this is the generic grading system for all manual muscle testing. So as you can see, the normal, which is 5/5, is basically being able to do the full range of motion against gravity with maximum resistance. A grade of 4/5 is doing the range of motion fully and resisting the gravity, but with moderate resistance. A grade of 3 is doing the full range of motion and resisted to gravity, but having minimal resistance, which is the 3 positive, or an eliminated resistance, which is a negative. A poor diagnosis of MMT is the 2/5 positive and negative. The positive is a full range of motion with minimized gravity. So it would be either horizontal or towards downwards, so assisted by the gravity. And the resistance that is applied is moderate or minimal. There is a resistance applied. For 2, which is a full range of motion also, but with minimized gravity, so it's either also horizontal and so on. And a 2 negative is a partial range of motion with a minimized gravity. A trace is a 1/5, is basically just feeling a palpation on the patient in the muscle belly, but there would be no it would feel like an isometric contraction basically, with no gravity and no resistance. 0 is basically there is no contractions at all. So there's a question that I raised before to one of my peers, which is, if a muscle has a high grade in MMT, can it function well? So basically, my reason for asking that question is to actually let other people be aware of this, as in, not just because the patient has a 5/5 muscle means that they're able to actually use it in a functional assessment, in a SOAP documentation basically. Like if a muscle has good grip strength and so on, it doesn't mean that they would be able to wash dishes normally or clean the house normally or grasp objects easily. There could be other pathologies or problems causing the negative functional assessment that is being employed. So it's not always the problem with the muscle, it could be a neurologic problem, and we have to keep in mind that to address these problems. And thank you for listening. This is basically the lecture on manual muscle testing. Thank you.